The FCTC's traditional government-led public health measures have been partially successful and in many parts of the world have actually contributed significantly to lowering smoking rates. They remain the cornerstone of a lot of public health policy, but progress has been too slow. As Deborah Arnott, chair of ASH here in the UK, wrote, nearly a decade after the convention has come into force, only one country has implemented all these policies at the highest levels, and 40% had implemented none. It's time to address the need of smokers by stepping up harm reduction and smoking cessation. This will be done by engaging with all those committed to end the use of combustibles. And this is the spirit of FDA Scott Gottlieb and Mitch Zeller's August 2nd comments on tobacco regulation, in which they explicitly acknowledge the need for standards which, in their words, should mutually benefit industry and the FDA. Senior global health leaders have started to acknowledge the importance of tobacco industry transformation and what it means for how we engage with industry to build solutions. In the opening session of the preparatory meeting for the third high-level meeting of the General Assembly on NCDs recently, Sanya Nishta, a co-chair of the WHO Ad Hoc Committee on NCDs, addressed technological innovations shaping the future of healthcare and added that, in her words, the private sector is aligning incentives to announce the end of cigarettes. She went on to say that attacking lifestyle choices, corporate interests, vilifying others, or creating an oversimplistic enemy narrative is not going to help. I fully agree. Progress can and will be accelerated by technology disruption and by the change in the very structure of the tobacco ecosystem, starting with the biggest players. One significant but rarely discussed reality is China's dominance as the major source of combustibles, and I'm thrilled to see such strong representation here today. Current data shows that China National Tobacco Corporation accounts for approximately 38% of worldwide cigarette production by volume. The largest 15 producers worldwide producing 86% of production globally. We will give substantially more details of what this means over the next months. China is well positioned to assume leadership in industry transformation and develop reduced harm products relative to combustibles and to displace combustibles. To borrow a Chinese saying, we are all in the same boat in a tempest. If the Chinese were to embrace harm reduction across their vast monopoly, the global impact would be huge. I believe this is inevitable. China's leadership is sending the right signals about ending the use of the combustible motor engine. China is also home to where e-cigarettes were invented and where most are currently made. And it's impressive to see the large delegation from Shenzhen here at this conference. In January 2017, I was privileged to hear President Xi addressing the World Economic Forum in Davos, where he made a powerful commitment to expand the use of technologies in the service of humankind. The health gains from expanding technology to end smoking would be massive and unprecedented. What specifically will the Foundation do to support industry-wide transformation to end smoking? I hope many of you have seen our announcements about an RFP to investigate biomarkers of exposure to nicotine delivery products. With better biomarkers of exposure, epidemiologists could evaluate the impact of new reduced harm products faster and more effectively than simply using questionnaires. Researchers could report data currently provided by self-reports. Insurers could improve their underwriting to fully capture risks. And consumers, once we get the test down low enough, could assess their change as they switch or quit. We're investing in academic centers to plug deep gaps in human and institutional capacity to drive a 21st century technology-enhanced approach to ending smoking globally, and particularly in the developing world. We've announced our first center, and we hope more will be announced over the next few months. We will soon also announce plans to stimulate the development of a pipeline of more effective and affordable smoking cessation products needed in developing countries. Current cessation methods are simply not having the desired impact, and the pipeline for future ones is virtually empty. As mentioned, we have launched the first of regular polls to deepen our understanding of how best to help smokers quit or switch. We're now building a platform to dynamically interact with smokers, correct misperceptions of risk, and provide them with solutions to quit or reduce their risks. There are many other areas I could go into as well, and in this very conference, a number of people have identified areas requiring the kind of investment that the Foundation can and will provide. The work on agriculture will be covered in a panel later today. These are all necessary measures, but together they remain insufficient to tackle the largest opportunity of the lot of transforming the entire sector. Our first contribution to that vision is announced today. We must learn from others in not relying solely on government-led actions. Voluntary industry-wide efforts that complement and in some cases lead government regulations are needed. We launch a bold call for proposals to develop and implement the means to critically evaluate and scrutinize industry progress towards a smoke-free world and highlight actions taken by industries to undermine such progress. The aim of this initiative is to develop an annually published smoke-free index. We expect the successful grantees to take the following actions: provide quantifiable evidence of how companies are addressing or impeding transformation. We heard from Suzanne some of the data on R&D, the size of the research team being deployed. That needs to be known and needs to be far more widely known across all companies. They will be required to collect and compile verifiable metrics on research, on shifts in capital expenditures and marketing away from combustibles towards reduced risk products, evidence of the phasing out of cigarette production, and much more. And already early indicators of many of these elements are out there in reports scattered all over the place. They need to monitor the extent to which the tobacco companies make reduced harm products available and affordable, not only in high-income countries, but also in low- and middle-income countries. We applaud the Sustainability Accounting Standards Body for producing a provisional standard that covers some of this and propose standards for sustainable accounting in the tobacco industry specifically, but we go much further. By undertaking this program, we're building on insights gained from related approaches that are already well underway assessing the pharmaceutical companies and food companies. We also build on the work of the climate-related task force I referred to earlier, that's under the chair of Michael Bloomberg, that relies on strong financial disclosures to actually drive change in a more effective, transparent way. Successful grantees will engage in a series of listening seminars in multiple countries with all key stakeholders with an interest in trying to address the tobacco issues. Tobacco control groups, investors, academic, policymakers, and the tobacco industry need to be involved in the development of the evaluation criteria. That has been a determinant of the success of participation and engagement and will be a success to ensuring that the data is verifiable and used both internally and externally to drive change.